We mentioned earlier about the growing number of cases in the St. Louis area. We want to break those down a little more. Across the state of Missouri, we saw a 28% increase in cases from yesterday. In the St. Louis area, we jumped from 629 cases to 860 cases, which is a 36% increase. That is the biggest percentage jump we've seen since cases were reported. And an infectious disease specialist at Washington University told our Casey Nolan that this is going to get worse before it gets better. He also calls it a narrow window as far as slowing down the virus.
The health experts agree. The time when Missouri will see its peak number of COVID-19 cases will come later than in other parts of the country, like, say, New York. The good news is that means we have more time to try to do something about it and lessen the impact this virus has on Missouri and the St. Louis region. The concern is people will see that lag time and think it's not as big of a deal, let their guard down, and actually make the problem worse.
We've got this very, very brief window of opportunity that is rapidly closing where much more aggressive enforcement and widespread adoption by everybody to take these measures seriously, it still is able to make a significant impact because we're still probably 2 or 3 weeks away from what the worst of this that we may see.
Do you think we should be doing more as a state? Because obviously the virus knows no boundary between, say, St. Charles and St. Louis County, yet there are different measures in place.
I think that any measures that are undertaken to increase the amount of physical distancing and decrease the opportunities for people to be within 6 feet of each other on any regular basis, anything that is done to increase the ability for us to use that physical distancing will save lives. It's pretty likely that the more stringent of a requirement that you have, the more lives that will be saved. We have the luxury of lead time. We have seen what this can do in New York City and in Seattle, in Italy, and we have the conscious ability to decide to make and take action that will do everything we can to prevent a similar situation occurring here.
That was Casey Nolan reporting. The doctor says it's just too hard to pin down how many cases we could end up seeing. He says what we all need to focus on is the social distancing of at least 6 feet.